My name is Phil Perazio, and I'm a urologic oncologist, a surgeon. Like many of you, I absolutely love what I do, and I would not choose another profession. But I have struggled with professional identity, practice efficiency, and wellness over the years. Operate with Zen is a podcast designed to explore a mindful approach to surgery and to being a surgeon. By discussing these struggles and mindful solutions, I hope together we can create a community of strong and healthy surgeons. Enjoy. Welcome to this episode of Operate with Zen. Today we've got the great pleasure of being joined by Dr. Bradley Erickson. Brad, introduce yourself to the audience.
Hey, Phil, thanks for having me. I'm Brad Erickson. I'm a urologist at the University of Iowa. Let's see, from Iowa, did my undergrad at Creighton University, went to University of Iowa Medical School, and then residency at Northwestern and fellowship at UCSF. I've been back at Iowa for 12 years. I'm reconstructive urologist, kind of a jack of all trades urologic, I'd say.
Well, excellent. And in full disclosure, Brad and I are ski buddies. We try to meet at least once a year and go skiing. And we have some really deep conversations sometimes and some really shallow ones too. But we've got an interested kind of past too, where we both played baseball in college. He played at Creighton, I played at Georgetown, which are now in the same conference. We would have, if we went to college now, we would have played against each other, which have been really interesting. And people always ask, Brad was a pitcher, I was a catcher in college, and I think we would have worked well together in the battery.
I think so too. I think it would have been a lot of fun. One thing that we have not done is brought our gloves out to Colorado when we go skiing. I mean, it's a little hard to throw on ice, but I'm looking forward to that first catch that we have.
I will bring my mitt next time. I'm sure I can fit it in. I'm sure I can fit it in that ski bag. Well, good. Well, today, Brad and I have a lot of conversations about wellness and mindfulness and culture in surgery. And so today we wanted to kind of have one of those conversations with all of you. And Brad's got an amazing story of resilience and kind of triumph over kind of some of the struggles that we all go through. So Brad, if you don't mind, let's start there. Start with a little bit of your story through story to wellness. Let's call it, let's put it that way.
Boy, I don't know about triumph, man. I mean, I'm just like, I feel like I'm just kind of going through what all of us maybe have gone through. I guess I can give you, I don't know how much background you want, but, you told me, I told you a little bit about my educational background. I think that's where we all kind of default to. That's kind of our currency. But yeah, I came from a family of, I had a dad that was an artist, a mom that was a music teacher, no medical background in the family. And I always kind of thought I wanted to be a doctor for reasons that I'm not entirely clear. Maybe I thought that it was cool because it was science, or thought it was a good challenge, or, maybe I thought it'd be fun to make a little bit more money than my parents made. Who knows? But turns out that I did pretty well in school. And, one thing leads to another, and I find myself in medical school. And pretty instantaneously, I knew I was a little bit out of my league. Listen, you mentioned that we played baseball. My feedback in college was, strikeouts and wins and saves and all the other stuff that we did. So I had kind of that instantaneous like feedback. That's how I kind of defined myself. My entire life was sports. And you get into medical school and that's all you got. No coaches, no practices, nobody telling you what to do. And for the first time in my life, I kind of have to figure out a way to get positive reinforcement. And so there are plenty of ways to do it. Tests, in medical school, it's mostly tests, but then it's like MCAT or USMLE, all this stuff. And, you just kind of keep rolling. And I found myself at Northwestern, and man, it was like a perfect environment for me. Love the big city. Everybody was kind of built like me. We were all really into writing papers, and I don't know, kind of, well, it was a great culture. And we have a lot of mutual friends that were at Northwestern at the same time that I was there. And uh, a lot of really good friends have came out of that, but it was pretty competitive. And it was, we pushed each other pretty hard. And, it got me a great resident or fellowship. And then I'm at UCSF amongst very similar people, very competitive. And a lot of great things came out of it. And then found myself at Iowa. And, now I'm like, well, what's next? Well, shit, now I got to write some grants. So, wrote grants, write papers, and keep rolling, keep rolling. Things are going great. And then, I don't know where the realization came. It probably came when I was having a lot of trouble sleeping, that I realized, like, man, I don't know if I can get off this train. I don't know where it's going, and I'm not sure if I can stop. And it kind of culminated of all places, at an AUA meeting. And this was when I can tell you exactly when it was, like when I was 39, so it would have been 5 years ago. And I could see 40 on the horizon, thinking, man, I remember when my dad was 40. I'm kind of getting old, and I don't know I don't know where this is all headed. And it was like one of those things. I had like 5 residents, a couple medical students, all doing abstracts with me, and they're giving podium presentations. I'm running around the AUA, and I'm like, man, this is just like, I'm firing all cylinders, and like this is the culmination of what academic urology should be. I'm like everywhere in all these rooms. And one of my residents gets up on the podium and is given this talk, this abstract, and somebody asked this question, and he totally bombs the answer. Just totally bombs the answer. And I'm like, God damn it, we did all this work, and you like totally screwed it up. And so, like, I don't know what my emotions were, but I got up to the mic, and I started to like kind of clarify it. And then like, I don't know, man, all these weird emotions started going through myself, and I like kind of paused, stopped talking. It's very clear now in retrospect that I just had this panic attack in the middle of the AUA. Took 30 seconds or so, and you can imagine 30 seconds at a podium of silence is like 10 minutes. Finally recovered, kind of asked the question, but was like devastated. Talked to a couple people afterwards. I'm like, what did you think just happened there? And they're like, are you okay? Like, I'm fine. And the thing is, and you're probably thinking like, oh yeah, you've seen something like that. And you just move on. But my take home from that was like, oh my God, everybody at this meeting is now like asking what the hell happened to Erickson when he was asking that question. All right. So, nobody gives a shit, as I know. Like, everybody forgot about it. I was the only one that cared, but that's not what I thought. So, I go home from the meeting, still kind of perseverating about it. And and Phil, it's been like 5 years, so I don't remember exactly how it all happened or transpired, but that was definitely kind of like the thing that pushed me over the edge. And I started kind of thinking, the hell am I doing? And yeah, I had this really rough 3 days where no sleep. And on that third day, it was like a Saturday morning, and I told my wife, like, man, I don't know if I can keep doing this. Not like life, just like work. And I'm like, I'm not sleeping. And so I called my chairman, Carl Creeder, And I'm like, hey man, I don't know what's going on, but I can't sleep. It's been like 3 days. I've got a big case on Monday and I can't do it. I'm not going to come in. And, he was very supportive. He's like, hey, that's great. I'm not great. That's, whatever it takes, man. And it was great. There's a mechanism for this, but it's really only in these crisis situations. And somebody called me, I met with him on Monday, still wasn't sleeping very well. He prescribed me all these meds to help me sleep, none of which worked. And I will say they tried to prescribe trazodone to me, and I'm like, hell no. I'm not taking trazodone. I don't care. I don't care if I don't sleep for a week. I'm not taking trazodone because yeah, if I gotta get priapism, then
A little too close to home.
a little too close to home.
Yeah.
So yeah. Um, so I didn't take enough time. I honestly didn't take enough time. I took two full weeks. And those 2 weeks were really tough, really hard. But I met with a psychologist, during that whole time, and we're going over all this stuff, what was it? There was, and he kept going back to that, that thing at the AUA. And he's like, listen, that's not the thing, right? I mean, let's talk about all this other stuff. And so start going back to, just the buildup, this feeling of, always trying to have the next success, always just assuming that everybody's kind of watching your progress and that you've got to continually prove to people that you are, that you're worth being here. And, they got a name for that now, this imposter syndrome stuff. I think that's fine. I think that's maybe a good name for it. But I think I don't know if I'm just trying to like make sure that I'm worthy of this job. And yeah, I mean, every single thing that you're trying to do throughout the day, you feel like you're continuing to prove to yourself that you're worth being here and maybe prove to other people. And so when you go to bed at night and you're thinking about all the shit you just did, all the shit you have to do, and all of the things that you maybe forgot to do along the way, it's tough to turn your brain off, And so for me, the thing that kind of put me over the edge was not that I was having those, kind of perseverating thoughts. It was just that I couldn't sleep. And when you can't sleep, after a couple of days, you're pretty dog shit. So yeah, anyway, that's how it all started. I mean, we can certainly talk about what happened after that. It's been 5 years. It's been 5 years since that incident.
Yeah, no. And first, I just want to say thanks for sharing. And, part of the reason we have these conversations is to normalize these things. These things happen to us. This is part of kind of a surgical career. And the hope is that by you and I having this conversation, by you and I reaching out to our colleagues and junior faculty and the people who are coming up to try and maybe prevent some of the really tough situations that we've all been in, we're going to go through them. But if we can lower that threshold of what puts people into real despair or real spins, then we're doing good and we're making them feel better. So thanks, first of all, for sharing that.
Yeah, sure.
I'd like, if you don't mind, I'd love to get into, if now that you've had kind of 5 years to reflect on this, let's talk a little clinical practice, academic practice, kind of the contributors to that. I think, they all sum up in my mind, at least, to one theme, and it's this kind of sense of self. And we struggle with this. And you're right, they call it imposter syndrome now, but I really think it as a identity crisis. We don't know who we are, particularly when we are fresh surgeons, when we're coming out of training and all of a sudden on our own. Are we, these really big clinical people? Are we academic? Are we somewhere in between? Are we teachers? Are we educators? Are we grantsmen? Are we about getting grants? And I think a lot of us really struggle with that identity, and we're not sure who we are. and then fold on layers of who's our chairman think we are, who does the
Mm.
institution think we are, and how do we fit into that model? And I think that's one of our biggest sources of struggle, as particularly as young surgeons. And I don't know what you think of that.
Well, I think this is an insane job, for us to think we have, the audacity for us to get right out of fellowship and think that we can walk into a patient's room and be like, okay, I'm going to cut you open and take out your bladder. I mean, come on. That's that I mean, our training is good, and all of us get good training, but to take that leap, to take that mental leap to go right from training to doing these big operations, I mean, we're fooling ourselves to think that we are fully prepared for that. And we know, that's the reason they call it a practice, but we know that we are not ready. And yet we still do it. And um, and then and then and then and then it becomes just so commonplace that we will sign them up for surgery. And it's not to say that we're being dangerous, but we just start to appreciate. I'm 12 years into this now. We just start to appreciate that there is only so much preparation we can do, and there's only so many things that we can do before surgery. And then we just have to get into the operation and accept that there are things that we can control and some things that we can't. But I think that there's a reason why some people succeed as surgeons and some don't. And I hate to say it, there is some natural abilities that some people have as surgeons, but I think one of the things is just the being able to get over that mental hurdle of um, really tricking yourself into saying that you can do this, because what we are doing is absolutely insane. And to think that people trust us to do these operations is insane. Um, and yeah, I'm definitely more confident than I am. I'm more confident now than I was 12 years ago. But I still think a lot about these cases, and I'm still visualizing all of them. And I think that for us to start a surgical practice, to not only have that on our heads, but also writing grants, writing papers, trying to teach residents, trying to teach medical students, making sure that we're good fathers, and then trying to stay active and, maybe run a few marathons on the side. It's no, I look back and it's no wonder that I had some struggles early on in my career. I think you're right, though. I mean, I'm sure that there will be some people that know me that will maybe hear this and be like, "Oh man, I never would have thought Brad's going through this." I don't think that we really are good about sharing this kind of stuff. And when you asked me to come on, I'm not sure if I would have done this 7 years ago, but I'm 12 years in, so maybe I feel more comfortable sharing. But I'm sure there are other people that struggle with this that just don't talk about it.
Yeah, no,
I
absolutely.
I probably didn't answer your question, Phil. I'm sorry, but
No, no,
yeah,
no,
yeah,
it's perfect. And
yeah,
I love your reflection there. And I think, what we do is absolutely a privilege. And it is a truly scary privilege for people
I
to
like how
kind
you
of,
turned it. You turned it from ridiculous. What did I say? Insane, and you
yeah.
said privilege. You're right. It is a
No,
privilege.
but you're right. It's an
Yeah,
absolutely
yeah.
insane privilege
You're right.
that people put their faith and trust in us. But that's also, kind of what's amazing about our field and the relationships we build with people. And
Yeah.
looking back at it, what would you wish you had done differently, or people had done for you, or what do you do now for your junior faculty? How do you kind of, how do you get better from this experience?
Yeah. Well, I knew you were going to ask something like this, and I always struggle with this a little bit. It's always hard to say, man, I would have done things differently had I known. But I'm Well, here's the thing. Wish that I would have been able to talk about this candidly with other people and kind of feel like other people are going through this. I suppose had I known that it would have been good to reach out to other people, I think that would have been good. Just knowing that other people, when they get up on a podium at the AUA, are scared shitless, just like I was. How many people get up there and they just nail it, and you're like, oh man, that guy's so talented. That guy just has their shit together. Uh, I'm guessing that have all those people are scared to be up there. There are a few people that are naturally talented and gifted and can get in front of people and give these great talks. But if people knew like the many hours in my hotel room, the many weeks before the meeting, all that stuff that goes into preparing and getting ready for that, I don't think that they would think that anybody's naturally talented getting up there. So I wish that people were more able to share that, and I wish I would have had somebody to talk to about that.
I
But
think that's a great point, Brad. I'm just going to interrupt you for a
yeah,
second. I think,
yeah, sure.
and I think that's one of the falsehoods that we perpetuate in surgery all of the time. And is that where there are naturally gifted surgeons and there are naturally gifted speakers and naturally gifted grant writers. Those people work incredibly hard, but they don't. But part of the falsehood is they don't show the hard work, right? It's kind of, we don't talk about the hard work that goes into all of those things. It's like, oh yeah, I just do that. No, you don't. You work really hard at that. You
Yeah,
worked really hard at your craft. I've worked really hard at my craft. The people we know who are really exceptional in what they do all worked really hard at what they did. And I think there's more and more kind of science and theory kind of supporting that. Not that there aren't people who are gifted, but the people train to be really good, I guess is what I'm trying to say.
yeah. Well, right. Um, yeah, I feel I feel like I've always had to work really hard to get where I am, but I'm certain that there are people that view me differently, that think that it's always been really easy. And maybe that's part of imposter syndrome. Everybody thinks that everybody has it easier than them. I don't know. I can't speak for anybody else. I can't speak for what anybody else thinks about how I got to here, but I can tell you that I personally have felt that it has not been easy.
Yeah, well, I'll tell you. I mean, listen, before
Mentally
we
very
became
taxing.
friends,
Yeah.
yeah, before we became friends, I mean, I thought you were one of those guys who would just kind of walked and talked and got it done. You know what I mean? But
But now otherwise.
well, listen, we share conversations. We talk about all the work and the hard times and the hours we put into these things and what really stresses us out and what doesn't. So it really does normalize the experiences that we've had.
Sure. Well, what I was going to say though, what would I do differently? I don't think I do. See, the thing is, I don't think I do anything differently. That's 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 the that's the rub, is that I wouldn't do anything differently. And honestly, those, that kind of experience that I had, that, I was out for a couple weeks, and, where I legitimately thought, yeah, there's a chance that I'm not going to be able to come back to this. I'm not going to be able to come back to work. I just don't know if I can do it. Um, I'm glad that happened to me. It's great. I mean, I'm glad I got through it. I'm sure some people wouldn't get through that or would say it's not worth it. But I really, and the other thing is maybe we're missing from this is I genuinely love this job. I mean, you said it was a privilege. I mean, oh my God, it's so awesome. I heard something recently. I wish that I could quote it and know who said it, but uh, there's this concept of work, of loving your work, and it's the three H's. It's jobs are jobs you use your hands a lot, you use your head a lot, or you use your heart a lot. And there are some jobs that focus on one of those. And I think that being a surgeon allows us to be good at all three of those, especially an academic surgeon, where you get to use your hands, you certainly are using your heart, but then that third thing, and I shouldn't say just academic surgeons, all of us are using our head, but thinking of writing grants, writing papers. And what this guy said, and maybe afterwards I can find out who said it, but you find yourself you know really involved in the head part of it, where you're sitting at your desk and thinking about things all the time, and then you realize, like, just got to get in there and start doing stuff, and work it. And if you have a grant due, or you're writing a paper, sometimes all you want to do is just take a bladder out. It's gonna make you feel better. It gives you that instant feedback. Or sometimes you're really down on, you had a bad case, or you get a paper rejected again from JU, as they tend to do. And you see a patient that is great, and you just really genuinely feel connected to that patient, and that brings you back too. And so that I've really thought more about this head, heart, hands thing, which is one of the reasons why I think being a surgeon is so great.
Yeah, the Eastern concept of that, or the Buddhist concept, is dharma, which is right where passion and skill and usefulness meet compassion and empathy, right? Where we can use all of those components, and that's where we can be not only our most useful, but get the most reward out of it. And it's the true joy of medicine and surgery. So yeah, I'm spot on. I like the 3 H's a lot. I think it's a little more concise.
Yeah, and you can't just be knocking out cases all day long, or you
Right.
lose perspective there too, right? You've gotta have time to reflect on everything.
Yeah.
Yeah.
So, so obviously you've come through this and had, opportunity to reflect on it. So, honestly, how long did it take you to kind of recover from this episode to where you kind of felt like you hit steady state again? And talk to us how you got through it.
Sure. You wanted to talk about mindfulness, so we'll kind of talk a little bit about that. Well, let me first tell you how long did it take me to get through it. 2 years. So I took 2 weeks off. It took me 2 years to get my shit together. And during that whole time, I'm sure that from the outside, it looked like things were good were good. But, if you want to consult my wife, you can tell her, it was, and again, it was really difficult to get the sleep back in order. And for anybody that's ever had insomnia, which is essentially what I had, uh, it was, starting at about 7 or 8 o'clock PM, kind of right after dinner, you start to get this anxiety that that sleep is about ready to come up. You're about ready to have to go to bed, and you just know that you're going to lay there for an hour and a half and not fall asleep. It's really an awful feeling. And so there's a lot of tricks that you can do. There certainly were some, for the first probably 6 to 9 months, there were medications that helped. I don't like taking any of that stuff. It just kind of makes you feel groggy in the morning. But yeah, it took about 2 years to get through the sleep thing. We don't need to talk about sleep, but I will say that the thing that saved me, and I was doing this throughout the first 6 to 9 months, is cognitive behavioral therapy for sleep. There's this program that I use called Shut Eye, and it was offered through our employee health, but it's cognitive behavioral therapy. It's all online, and just in summary, what they do is they ask you to give your average number of hours that you've slept over the last 2 weeks while you've been having quote unquote insomnia. And I think my average when I started was something like 3.5 hours. So, it didn't even go that low. It made you start at 5. So just to say where I was starting. But then what they tell you is like, okay, well, you're only sleeping 4 hours a night and you have to get up at 6. That means you can't go to bed till 2 a.m. or you can't go to bed till 1 a.m. So instead of trying to go to bed at 10:30, you go to bed at 1. And It was pretty awful, but it actually does. It helps train you. And then every couple of weeks, you add a half an hour or so. And so, yeah, now 5 years later, doing great. There's a lot of other things that have happened, but that really was what saved me. So if anybody's having trouble with it, I would definitely suggest shut eye. I think there are other ones, but that cognitive behavioral therapy. I got through all of Game of Thrones too, which was pretty great. So that's when Catherine was in bed at like 10 and I was up till 2 o'clock. I got through the whole season of or all the seasons of Game of Thrones.
Yeah, and it's amazing how everybody's body manifests stress in different ways, and sleep can be a real sign that you're struggling, and
Yeah.
it is one of the early signs for surgeons, to be honest with you, and we see it a lot. And there's a difference between sleep hygiene and when you're really struggling where you are or where you were. And I think it takes a lot of credit to ask for help. And it's amazing when you finally get to a good night of sleep, how it can completely change your perspective. And
Oh,
just to give a non-stressful, or not necessarily non-stressful example, I mean, anybody who has kids, you remember when they're newborns, and then all of a sudden at some point in the first few months, you actually get a night of sleep, and it makes you realize what sleep does for us, and being refreshed.
yeah, it's remarkable. I mean, it's absolutely amazing how important it is. And yeah, I'm totally an advocate, believer in sleep hygiene. I actually was just I went to a fundraiser this weekend for Iowa football. Um, it was kind of a one-off, had something to do with urology, believe it or not. But we got a tour of all the workout facilities. It's amazing. I mean, compared to what we had when we were playing Division I sports like 20 years ago, what they go through now, the nutrition, the weight rooms. But one of the things they emphasize, the trainer, is that they all wear sleep monitors. All the Iowa football players wear sleep monitors, and it gets reported back, and they can see how well their athletes are sleeping. Because they feel that that's as important as any weight room that you're going to do, is to making sure that you're sleeping well. So, I mean, the cat's out of the bag. I mean, people know that sleep is important.
Yeah,
I mean,
except surgeons.
don't you remember when we were in, like, all of us in medical school were like, oh man, I'm tougher than that. I don't need to sleep. I'm going to stay up till 2 o'clock in the morning and get up at 5. And you used to pride yourself not having to sleep or not needing to sleep.
Yeah.
I can't imagine that that's helpful. Probably got
No.
some, what are those, some some bad. I can't remember the name of the protein that I'm going to tell you that causes Alzheimer's. So
Right. Yeah, it's because you didn't
the
get enough
tau
sleep. Yeah.
the tau proteins or whatever.
Yeah.
It,
No, I mean,
yeah.
listen, and the science is there that the rest
Uh-huh.
cycle is just as important as lifting weights, as the training, as studying in the library.
Mhm.
All of that stuff is meaningless if you are not well rested, which I don't know, gets thrown right in the face of everything we did in our training, our
Yeah.
entire careers, and our entire life. So it just shows me, this is one of the things that I work a lot with junior faculty and junior people on, is carving out time, making sure they're sleeping, and our residents that, listen, go home, get out of the hospital, because I want you back tomorrow where you can be really into our operation, really into what we're doing, rather than sleepwalking through it, which I did through a whole bunch of my residency.
Yep.
Yeah.
Remember those, well, I mean, I still do it every once in a while, but remember those, those cases that you do and you haven't slept for 36 hours, and there was some some weird, like, almost, I don't know. It was just a weird kind of out of body experience when you're
Yeah.
trying to operate, when, like, your body's asleep and your hands are still moving.
Yeah. Takes all of
Yeah.
your energy and focus just to kind of, you know,
Yeah,
keep
it's
going.
not good. It's not
No.
good. So,
No.
I totally advocate 80-hour work weeks. Yeah.
So, one of the things we've talked about and shared is mindfulness practices and
Right.
meditation. And I know that's been part of your, call it, resilience. So, talk us through your experience with meditation and mindfulness, and where you are now with your practice.
Sure. So I, I started actually doing, believe it or not, I started doing meditation prior to all of this. Uh, and there was there's a town in Iowa called Fairfield, and it's got the Maharishi University. And we have a lot of patients that come through Iowa that have done transcendental meditation, or TM is the name for it. And it goes to show before 4 or 5 years ago, or kind of the time I was talking about, I was trying to figure out ways to help with some of the stress reduction. So transcendental meditation is what I did. For those that don't know what that is, it's kind of a mantra-based meditation. So they give you it's a class, you sign up for it, you have a guide that helps you, and it's like a 2 or 3 week course. You got to take some time off, which I did, and they teach you how to do mantra-based meditation. So the idea is that you kind of say a mantra, and what that mantra is supposed to do is kind of have you drown out some of the other thoughts, right? So the thoughts in your head, or kind of perseverating on the back pain that you have, and it focuses you. And I really love doing transcendental meditation. It kind of almost puts you in a trance-like state. Sometimes you kind of lose the consciousness, or you kind of find yourself kind of outside of your ego. And I really liked it. But the problem, the one of the reasons why I kind of gravitated away from it is that the emphasis on transcendental meditation is really to put yourself in this kind of fake environment, I guess. That it should be dark and quiet and cool, and you shouldn't have eaten for a certain amount of time, and you really want to put yourself in a place that there's no distractions. And so the goal of that then is to allow this mantra to kind of put you in this state. Now, I'm sure the TM people would say otherwise, but or you would say it's not all about that, but it really did kind of put you into this state. And I loved it. But that was so hard to achieve. Like, that place was so hard to achieve. And I always felt like I could never fit it in, because I could never find that 20 minutes where all of those criteria were achieved. And so I started to look more into mindfulness meditation. And I have to say, I mean, that wouldn't have been able to do this without hearing Sam Harris talk about this. And we've talked about Sam Harris, I believe, right?
Yep.
He has a waking up app, and I just find him to be probably one of the more influential people in my life, because of everything, his podcast, but also his mindfulness meditation. So for the last 4 years or so, I've done guided meditation with Sam Harris. And I'm not an expert, so I'm not going to tell you what mindfulness meditation is all about. But bottom line is, you can do it both open eyes, closed eyes, whatever. But the goal of it is to realize that all of the inputs coming in to your brain, all of the sensory inputs, sound, feel, taste, sight, thoughts, both future thoughts, thinking about the past, all of those things are really just showing up in consciousness. Emotions, those are all they're all going to the same place. And so when you realize that an emotion, you didn't, the emotion kind of came out of thin air, just like the sound from the hallway came out of thin air. You didn't create it. It just showed up in consciousness. And when you start to, when you really get into a good state where you're focused on breathing, and then you start realizing that everything that's coming into your mind during meditation is exactly the same as the feeling that's coming into your mind of sitting on a chair, or that feeling of taking a deep breath and your lungs expanding. All of that's the same. It's all coming into the same consciousness. And then you realize, well, what's the consciousness? Well, and who am I? What's the self? You can get really trippy, and get really deep into like, what's the ego, and I know you know Sam Harris pretty well, but he talks a lot about how it's no different than, say, like an LSD trip or an acid trip or something, and you can kind of trick your brain into losing and dropping the ego, and that's ultimately what you're trying to do. And if only for 5, 10, 15 minutes a day, just realizing that all of those thoughts that are coming into your head, you're not in control of those. What you're in control of is how you respond to them. And so that's really where I think my mindfulness meditation practice comes in, and why I've liked it so much better than, say, TM, is that you can do it wherever. I mean, you can sit in the middle of conference and be like, I don't want to hear about that anymore. So you just kind of close your eyes, and you can really just take a step back in your mind, listen to all, or just be aware of all of those inputs that are coming into your brain, and realize that they're all the same. So that's kind of where I am now, Phil, with it. And I, there's this thought that you do it 5, 10 minutes a day. That's probably about what I do. But also, the trick is, like, you can be mindful all throughout the day, and you can feel an emotion like anger is the one that I always like think is so funny. Like, what the hell's anger? Like, anger really does no good for anybody. Like, expressing anger is not cathartic even, and especially at work, it doesn't help anybody. And so I really, like, whenever I feel angry, I really just kind of take a step back and just say, all right, where is this coming from? And then you have to um, try to figure out the origins of the emotion, and then try to figure out how to fix it. Because they really did, like, anger is originating from somewhere. I mean, you didn't cause that to happen. You didn't cause it, not you anyway, not your ego. So what the mindfulness does, and has helped me, is just try to understand that I can control that emotion.
Yeah.
So the residents, if there's any residents that listen to this, they may they may beg to differ. But I tell you, you should have seen me before mindfulness. That's what I'll tell them.
Yeah.
Yeah. Anyway.
Fair point.
Yeah. Right.
So, obviously emotional awareness helps. And I always say, the analogy I give is, yoga helped me tremendously with kind of body awareness, and
Right.
meditation and mindfulness practice really, really helps with, as you said, emotional and mental self-awareness, helps you understand where you are in the moment, kind of emotionally and mentally, and really helps you kind of address that. I think that's been one of the biggest benefits for me in my practice. Yeah, go
I
ahead,
don't
Brent.
do I don't do yoga as much as you do, Phil. I know we've talked about that too, but it's the same idea with well, what it's doing is it's taking that body sensory uh input into your brain, and realizing that there are so many, like, neurologic inputs to your body, and yoga allows you to experience all of them. And then you kind of close your eyes during yoga and just be like, oh, there's a muscle I haven't felt for a while. That's interesting.
Yeah, or that one's really hurting from the operating room this week, and
Right.
let's see if we can, make that better. Yeah.
Yeah, but with mindful, I mean, I don't know if you've ever been able to do this, but I mean, legitimately, sometimes you have like a pain or an itch or something, and you can just kind of focus on that pain or itch during mindfulness. And it's amazing how all of a sudden it loses its importance when you focus on it. It doesn't affect all your other emotions, because you just look at it as another input into your brain. And I think that's right. So what do? You're nervous before an operation, and you can't do anything about it. You just kind of focus on that anxiety, and focus on those nerves, and realize that you can't control that. And sometimes, by separating that emotion from yourself or from your ego, it calms you down. It doesn't mean you shouldn't be nervous. You should be nervous. You should be anxious before a case. That's a positive and normal emotion, but you can't let it derail the operation. And um, I've been able to use that pretty effectively.
I think that's a great technique. is not only calling out the emotion or the anxiety or that extra energy or what it is, but then channeling that energy into something good. And that's something that elite athletes do all of the time. And I think something we can do in surgery.
Yeah, that's kind of I feel I okay. I wish that we would have had that in college, for somebody to talk to me. I thought I told you we'd go back to baseball, but I was a pitcher. And so um my first inning was always my worst inning. And I think that's pretty common for pitchers, because you're in the bullpen, you're warming up, you're worried about you're worried about that first pitch. You're worried about the first pitch, the first inning. But man, if a batter, if a batter swung at the first pitch and grounded the ball out to short, oh, so great, right? You
Amazing.
know, amazing,
Amazing.
amazing.
One pitch, one
Because
out.
one pitch, one out, that's what you want. I mean, it's like analogous to uh worried about a big lysis of adhesions, and you open up the abdomen and you're like, oh man, nothing. It's clear. It just like totally sets the mood, and the rest of the day is going to be fine. And I wish that I would have had some of those visualization techniques when I was pitching in college, because boy, there were some pretty rough first innings out there.
Yeah, no, and it's funny you think about it. That we're talking about mindfulness. I say it often when surgery is going well. Surgery is an incredibly mindful experience, right? Everybody's cued in on that patient, that problem, and when baseball's at its best, it is an incredibly mindful experience. 9 players in the field, at least one offensive player, and everybody's focused on one object and what that object is doing. And
Yeah.
it made me just think, I mean, it just came to me, I think there's lots of reasons it was America's pastime, prior to TV and all of that. It was a way to socialize and all of that, but it also is a mindfulness experience, right? Everybody could kind of cue into what was going on and put the rest of the world outside of themselves and really just love the game, right?
Right. When you're doing a 4-hour operation and then you're done and you feel like 30 minutes have passed. I mean, boy, what a cool thing to do. When you're so involved. I mean, that is absolute focus. And I think that's another reason why people love operating, why I love being there.
Yeah.
Get up on the mound, throw me the ball, you know, let's pitch. And you can't, you're not focused on anything else. You're just looking at that glove. You give me the sign and here we go.
Yeah. There's that,
Yeah.
I'll call it terrible, but I won't pass judgment. The Kevin Costner movie when he throws the perfect game, that baseball movie,
Yeah.
when he clear
Yeah.
the mechanism and everything goes blurry, like my background right now, except for him, the catcher and the batter. I mean, that's a flow state. That is the enjoyment of being in truly mindful and being present in the moment in the operating room or baseball or whatever it is. And I do think that's a great analogy from that movie.
Yeah. I like that. I like how you say, kind of flow state, being present. Yeah. I, I want you to and I do this to myself sometimes when I'm feeling particularly anxious. I realize that most of my thoughts are either about the past or about the future. Oftentimes we're thinking about things that have already happened or things that are about ready to happen. We rarely are like really present in the moment. And, things in the past you can't do anything about. Things in the future, you prepare in the present to try to make those better. But, I think somebody once said that if you worry about the future, worry about something bad happening in the future and it happens, then it happened to you twice. So, just can't do anything about it, I guess,
Yeah.
other than just prepare in the moment. So,
Yeah, I love it. So
yeah.
we've talked about kind of emotional and mental self-awareness with meditation and mindfulness practices. We've talked about being present. Any other benefits you've seen in your practice, surgically, that mindfulness has helped you with?
Hmm. Maybe more empathy. Maybe not in surgery, but I think to patients. Um, you know, these last 4 years have been difficult for everybody, I would say 4 to 6 years, maybe not difficult, but just interesting, just some it's been really hard for us to understand what some people are thinking and where people are coming from. And I think just mindfulness has allowed me to be more, show more empathy towards people that don't necessarily have the same views as I do. I mean, I think that wherever those emotions are coming from or wherever those thoughts are coming from, they don't necessarily have a lot of control over them. They're coming from that person's particular state of mind or what their current situation is in life. It's coming from somewhere. And when you're mindful and you realize that a lot of who you are is really a product of your environment, I think it allows you to be a little bit more empathetic to those, um, to their struggles and where they come from.
Yeah, I love that, Brad. I think that's really helpful, and being able to give people gracious excuses, for lack of a better term, right? To try and say, this is not me, this is you, and it's not necessarily something you're doing on purpose to get me riled up or to get me upset. This is just kind of, it is what it is.
Yeah.
And, I have the ability to either get upset with this or the ability to try and learn from it. And yeah, I think that's,
Yeah, I'm not perfect, man. And I listen, this it's a practice, just like it's a mindfulness practice, right? It's a mindfulness practice.
yeah.
We can always get better at this. Uh, but it's been very helpful for me to know that it's there. It's a tool, and I think uh, it's been invaluable to my life, not just in work, but with family, and yeah.
Yeah. And I think it's just important for people to hear. I mean, we're talking about tremendous benefits from mindfulness. We're talking 5 to 10 minutes a day, right? We're not
Mm.
doing this for hours. We're not isolating ourselves from our families or from work. My practice started with 1 or 2 minutes because that's all I could handle before I was wigging out. And now I think I'm up to 10 minutes, maybe 12 if I'm having a great day.
Yeah.
We're not talking about excessive amounts of time here. The benefits can be seen in small increments. And if you really like it, obviously you can build up, but
Yeah. If anybody's interested, I mean, you can go to Sam Harris's Waking Up app, and he'll give you, I mean, you get a month free of uh of his guided meditations. Just find his, I think my wife finds his voice to be a little annoying, uh and maybe a bit pretentious. That may be true, but I really like listening to him. He's got a lot of really unique insight, but his meditations are fantastic.
so I
Yeah.
think, yeah, one of the things we've been talking a lot about today is kind of overcoming struggle. And, we talked about your personal experience in academic medicine. We talked about baseball. We talked about the operating room.
Mm-hmm.
But one of the reasons I think clearly for your ability to come out of that was talking about it and seeking help. And I think it would be remiss to not mention that there are a lot of people in medicine right now who are not coming out of these things. And depression, anxiety, burnout, whatever term you want to lead with, and leading to suicide, and loss of our colleagues has been a real struggle. And I know you guys have experienced that at Iowa.
Yeah. No, we lost a resident last year. Brian Barnes, he was, a wonderful individual. Uh, sorely missed. A lot of us are, I mean, I can't speak for the residents. I think some of them were genuinely good friends with Brian. And I found him to be, he was a friend of mine too, as much as you can be a friend, faculty resident friend. We had just seen each other 3 days before his suicide, and it was really tough. It took this program a long time to recover, and for us to have, uh, uh, well, to have trust in each other. There's there's always, you always look for blame. You want to blame somebody, you want to blame something, and it's very easy to say, well, the program's what did it. It's too hard. We're working too hard or whatever. And so you start pulling back a little bit, and we did. We definitely pulled back a little bit. And then things start to come back slowly. And I think it took us all a good amount of time to realize that, it was an individual struggle in Brian. And, and we all wish that we would have known what was going on in his head. We all wish that we would have been able to been there to help him. And yeah, I don't really know I don't really know more what to say about it, other than, we miss him. We miss him greatly. And if anybody listening to this is having those thoughts, uh, I'd like to hope that they felt that they could go talk to somebody about it.
And one of the really tough things with depression, and I lost a really good friend during COVID, a guy I played basketball with. We lost somebody in the hospital when I was at Hopkins. And you can't even imagine the pain that they are in and what they're going through, to think that there is no one, that the world is better off without them. And it's a distorted mindset. And that's what depression does to people. And all we can do is tell people that we love them. We are here for them. And if anybody's struggling, just please reach out. There are people around you who want to be there for you and want to help you, and will do anything in their power to be there for you.
Yeah, I think that's right. Phil. Yeah, but at the end of the day, it's a bunch of people that are not suicidal saying, come
Yeah.
come talk to us, we'll talk to you. But you're right, it's just, I don't think that we can even imagine what it's like to go through that.
Yeah. I've had,
I've um you can we can certainly talk about this, but uh uh I don't know what Brian was going through. I'm not going to speak for him. I don't know what he was going through. I don't know if he reached out to somebody. I don't know if he felt like he couldn't. But one thing, to go full circle and to talk about my issues with the insomnia, is that I did find myself in the ER when it was in the morning, and I had called the physician that I'd been working with, and because I couldn't sleep, and she told me to go to the ER. They were expecting me. It's one of the perks of being a physician. And we talked through some things, and they asked the question. What was the question? The question was, do you feel like you want to hurt yourself? It's the first time anybody had ever asked me that. And first time I ever thought about it. And my answer was like decidedly, absolutely not. Like, fucking, I want to live, right? Like I like, the reason I'm here is because, like, this sucks so bad that, yeah, like, I need you to help me because I can't do this on my own. So I don't know if it was lucky that I was able to show up to the ER, on my own, or if I felt like I didn't have support to go there, or I wasn't embarrassed to go there. I don't know what it was, but I just remember being asked that question, and just, it was like a resounding, like, no, like, I definitely want to live, like, help me out here, but I'm sure glad that I had that feeling, because I can imagine, like, when you're so down and so, like, helpless, and I can see that mindset shifting very quickly into, the answer, like, being yes, and having the capacity to do it. That acute psychotic episode, or that acute depressive episode, uh I I am more aware of how that is possible without actually having been in that suicidal mindset. I understand it a little bit better now, because those are really tough situations. And in some ways I feel privileged to have experienced it, and get through it, but also very lucky that I felt like I was mentally strong enough to ask for help.
Yeah, that's incredible honesty. And Karen Schwartz is a psychiatrist who's on in one of the earlier seasons, and we talked in depth about depression
Yeah.
and suicide. And one of the things she said is that the reason it's so tough to manage in physicians are that we are so good at the system, and if you want help, you know how to find it, and if you don't want help, it's so easy to manipulate the system so nobody can help you, right? And to avoid to avoid the answer to the questions that are going to get you, kind of, in certain situations, you can manipulate where you're going to end up because we know how to work through the system.
Yeah, that's right.
Yeah. So we've been talking for a while, Brad. It's been a ton of fun. We got deep there for a little bit.
A little bit.
Yeah, a little bit, but wanted to give you the opportunity to kind of, shift the conversation in any direction you wanted to, or anything you think we need to cover that we haven't.
Boy, I said that what we did early on is like insane that they allow us to do it, and you rightly corrected us towards that. It's a privilege. It really is. If you find yourself listening to this and you're a urologist or a surgeon or even a clinician, I mean, if you're ever going through the day thinking like this sucks, this is no good, then you need to somehow course correct, because this is really great what we do. And if you're finding not a lot of joy in the job, then figure out a way to make it better. And if that means doing another job, doing something different, going back to do a fellowship, I don't know. I don't know what it takes, but I just know that if you've made it this far and you're a urologist, that there is joy out there, and there is purpose, and there's agency in what we do. And if the job that you're in is making you feel like none of those things are happening, or you're losing the joy, then it's not your fault, because this job's great. It's really a great job. I mean, I was here on call last night, super late, and I just remember we were talking about sleep. I just remember feeling like I was on top of the world, managing a whole service at like 2 o'clock in the morning. I mean, talk about purpose, right? Residency sucks, but you got a lot of purpose. It feels like you need to be there. And sometimes when you're a faculty, you kind of lose that sense of purpose. Everybody's doing stuff for you. You spend you feel like you spend your first 5 years trying to figure out how to ask other people to do stuff for you, and then you wake up one day and you're like, man, I'm not doing anything. So getting some of that back. I came in to put a stent in at 2 o'clock in the morning. I'm like, oh, this feels pretty good. This feels good. I need to be here. A little bit tired the next day, have an extra cup of coffee, feels pretty good.
And that patient needed you. The resident team needed you, right? It's an incredibly
The
fulfilling.
resident team didn't need me. The note signing needed me,
Yeah.
But yeah.
Yeah, but it's part of the joy in what we do, and thank you for sharing that, Brad. So you said some amazing things. We had a phenomenal conversation. I'll just kind of run through some of the high points here. We started off talking actually about sports, and we finished with a little bit of sports too, but we talked about all of the ways we seek positive reinforcement, and our competitive nature exists in medicine. And at some point we can get in a cycle of just competing to compete, right? Just what's the next thing? More cases, more patients in academics, more papers, more grants, and we lose sight of the purpose of the reason we're doing what we're doing, and that's what really brings the joy to us. And that's what I got out of your message and your story. And I've got to thank you again so much for sharing your personal story: insomnia, anxiety, seeking help 2 years before you kind of really felt recovered. And now 7-8 years later, you can look back and can be happy that you went through that experience because of how you've grown and how you've been able to mature and now help others and give a little bit of perspective in all these parts of your life. We talked about the 3 H's, which I love, the concept of dharma, right? Really getting hands, head, heart. And we're one of the few professions where all of those things come together in a beautiful way on a daily basis.
Right.
There's very few few jobs that have that.
And trying to keep trying to keep balance between those three, but also knowing that you can always, if one of them's not working out, you can always go to the next one.
I love that point too. Yeah. And I think that's incredible. We talked about mindfulness meditation, a little bit about TM or transcendental meditation. We talked about mindfulness, and we talked about how, as a surgeon, this helps with emotional and mental self-awareness, presence, being in the moment, and empathy, and our ability to interact with colleagues, patients, ourselves, and giving ourselves grace when we need to. We talked a little bit about baseball and some of the similarities between baseball and surgery and how to be really present. But I think one of the most beautiful things we talked about was this insane privilege that we keep getting back to, right? This is kind of the theme of this podcast, is this insane privilege that we have, and truly seeking out the purpose in it can keep us healthy and well, and promote a sustainable long career. And these are the things we can work on ourselves and then work with the people around us too.
Yeah, good summary. Did we say all that?
We did say all that. You said a lot of it, actually. I was listening.
Oh man. Yeah, well, it's been a privilege. Speaking of privilege, it's been a privilege to be your friend and to have you ask me to be on this.
Well, thanks, Brad. Always fun talking to you, and I look forward to talking to you in person sometime soon.
On the lift, maybe.
Hopefully. Definitely on the lift. Absolutely. Okay. Have a great night, Brad. Good luck on call.
You too, buddy.